All right, so we are recording and we are live, Barbara.
Ready?
Ready. Mm-hmm.
Thank you. And good morning, everyone. Thank you all for being on our Zoom media conference for this very important issue we're about to discuss. I'm Barbara Devane, and I'm so excited that we have media, we have speakers, we have other participants who are interested in affordable and accessible health care. We're very privileged, and I'm very privileged to be able to work with our first speaker. I'm the secretary of the Florida Alliance for Retired Americans, and we're a proud partner in the campaign to lower prescription drugs now. And we have the national campaign director with us this morning. Good morning, Margarita George, and welcome to Florida by Zoom.
Thanks. Can you hear me?
Yes.
Great. It's great to be here. Thanks for having me. I'm going to kick us off just by giving a little bit of context about what is happening. Obviously here in Washington, D.C., the debate about President Trump's replacement of the late Ruth Bader Ginsburg is taking center stage. But for us at Lower Drug Prices Now, this debate isn't about the Supreme Court alone, right? It's really about what's going to happen to healthcare, the future of healthcare, and specifically the future of healthcare with respect to aging people and seniors. And that's for a couple of reasons. One reason is, of course, because the Affordable Care Act, which covers 20 million people and has created a lot of new and important rules for insurance companies that stop things like discrimination for pre-existing conditions and gender discrimination and lifetime limits and annual limits, all of the regulations and consumer protections that have benefited millions of people. The Affordable Care Act did a lot to shore up Medicare and did a lot to reduce prescription drug prices for seniors. In fact, between 2010 and 2017, seniors saved over $20 billion in drug discounts. Now that's a great step in the right direction, but any senior in America will tell you it is not enough. And what we really want to see from federal lawmakers is a greater commitment and more action to do things like create negotiations in Medicare, regulate the drug monopolies, take away the prescription drug corporations' ability to charge people whatever they want, whenever they want. And it's a very timely debate right now because we know COVID has already killed 200,000 Americans. And the majority of people that have died are older people. 8 in 10 people that have died of COVID are people over age 65. And so the fact that we are in this pandemic, that we are in a Supreme Court debate that is really about the appointment of a justice that could overturn a law that has helped millions of people, including millions of seniors, and that President Trump and the United States Senate have chosen to prioritize rushing through a new Supreme Court justice instead of keeping their promises to seniors on prescription drugs, instead of passing more, much needed COVID relief and recovery, makes this debate a debate about values. And so I just want to put that out there as we prepare to listen to other speakers. Lower Drug Prices Now is committed to really holding drug companies accountable in order to make prescription drugs affordable for everybody, no matter how old they are, where they live, what they look like, or what's in their wallet. Most prescription drugs are created with taxpayer investment and funding. It is only right, particularly in a public health crisis, in an economic crisis like the one that we're seeing with COVID, that taxpayers should be able to expect a fair return on that investment that serves public health more than profit. And so really today we are here as this Supreme Court debate plays out to really ask senators to take a hard look at this debate and to choose their constituents over more politicking with our healthcare. The last thing that we need in this critical moment is to rush through a Supreme Court nominee who we already know is going to overturn healthcare. We already know what her position is going to be, because the president has told us that he's only going to appoint justices that will overturn Obamacare. In the middle of the worst public health crisis, when seniors are facing record high prescription drug prices, and keep in mind, GoodRx, the prescription drug analysis firm, just put out a report that tells us that not only are prescription drug prices rising, prescription drug prices, the price of prescription drugs are rising faster than any other medical good or service. Now think about that, because healthcare is very expensive in the United States. Of all the things that you could be paying for in healthcare, we are seeing the price of prescription drugs accelerate. That's not an accident, and it doesn't have to be that way. Rather than nominate a Supreme Court justice that will overturn our healthcare on November 10th, when the Supreme Court case, the California v. Texas case, goes to a hearing at the Supreme Court, what the president and the US Senate should be focused on doing is actually passing policies that would stop the prescription drug corporations price gouging, and passing a relief package that would finally give people in Florida and around the country the kind of relief that they need when it comes to jobs, healthcare, public services, and other basics that we know people are struggling with. So I'll stop there, and happy to turn it over to my fellow panelists to hear their thoughts as well.
Thank you so much, Margarita. And thank you for the many, many decades of service that you've given advocating for healthcare for all Americans. And so let's, you know, Margarita thinks in global terms and national terms. So let's go to our next panelist, Scott Darius with Florida Voices for Health, and give it a state perspective for us, Scott.
Awesome. Good morning, and thank you for having me. Florida Voices for Health. I'm lucky enough to be the executive director there. We're a nonpartisan, nonprofit health advocacy organization. We really work to capture the healthcare stories of low-income and middle-income Floridians and use those stories to help advocate for policies that increase access to care. So it's from that perspective that I hope to leave you all with a sense of what's at stake for Floridians when the U.S. Supreme Court considers the Affordable Care Act on November 10th. Without a doubt, the ACA has been a lifeline for millions of Americans, including nearly 2 million Floridians. With a repeal of the ACA, but a repeal of the ACA threatens the gains that we've made as a state over the last few years. Among the Floridians who would lose coverage are the 1.9 million who are enrolled in marketplace plans. The over 132,000 young Florida adults, young adults, under the age of 26 who are still on their parents' plans, and 287,000 children who gain coverage through different parts of the ACA, like the stair-step provision. But the ACA is more than that. In a state where an estimated 8.4 million people, so that's 52% of all non-elderly adults, have a pre-existing condition, the ACA's consumer protections are vital. The law has addressed the Medicare donut hole, which means a lot to Florida, especially as we approach what they call the silver tsunami. And it also has all sorts of anti-discrimination protections. It helps to bring even more funding to rural hospitals and helps to get Floridians into substance abuse treatment, which we know is a really big issue right now. So really, no matter how you look at it, Florida has a lot at stake with this nomination and ultimately the Supreme Court case. But it isn't just about numbers. As we'll hear from some of our guests, there are very real people depending on this coverage. One of the stories Florida Voices for Health has captured in our work was from a mom named Kyla, who was covered for the first time in her life after the ACA passed. It was shortly thereafter she was diagnosed with triple-negative breast cancer, one of the most difficult cancers to treat. After enduring many grueling rounds of chemotherapy, and multiple major surgeries due to complications, she says that she was extremely lucky to survive. She says that without the passing of the ACA, she would now almost certainly be dead. And she had been denied for coverage in the years before because having a C-section meant that she had a pre-existing condition. So for Kyla and the millions of Floridians who have gained coverage, and the millions more who could still gain coverage from Medicaid expansion, we hope that Florida's elected officials will take the time to seriously reconsider their way forward. Thank you.
Thank you so much, Scott. And thank you for all the great work you're doing in Florida. Because, you know, I'm one of those 65 plus people. I just turned 78 this summer. And, you know, the ACA, Obamacare, Affordable Care Act, certainly helps me, because when I went to the doctor for my annual checkup, there was no copay, thanks to the Affordable Care Act. And we have so many millions of retirees and senior citizens and the disabled and on in this state that really, really need affordable health care. And speaking of old people, you know, there's more old women in this state because we women live longer than men. So I also lobby for Florida Now, the National Organization for Women. So health care for women and our families is one of our core issues in Now. And we have the Secretary of Florida Now with us, and she's our techie. And she does a lot of work with the LGBTQ community as well. She could tell you all of her offices she holds, her task force chairs. And her name is Lakey Love. And I do love Lakey because this old dog doesn't do all these high-tech tricks like Lakey does. She's actually our technician today for Zoom. But even more importantly, she's going to run in the chat information on the Twitter storm we're having all over the country today. From noon to 2, there is a Twitter storm, and the hashtag is #SaveOurHealthCare. And Lakey will be running that during this program. And if you need more information, you can get in touch with Lakey or with me, and we can tell you how you can be involved. Now, we also want you to resume your tweeting in the Twitter storm tonight, because it's the first presidential debate. So from 9 to 10:30 tonight, please tweet during that time as well. Now, if you're an old dog like me and you don't do tweeting and twittering, we'll also provide you with the phone numbers and the email addresses, because I'm going to call and email Senator Scott and Senator Rubio and ask them to think about the millions of Floridians that will be thrown out of their health care, their much needed health care, if they destroy the Affordable Care Act. So Lakey, come on down.
Thanks, Barbara. My name is Lakey Love. I use they, them pronouns, and I am the chair of the Florida Now Queer, Transgender, and Non-Binary Plus Task Force. I'm also the co-founder of the Florida Coalition for Transgender Liberation, and I'm here today to talk to you very specifically about how this SCOTUS decision and the decision on the court case on November 10th about the Affordable Care Act impacts transgender and non-binary and LGBTQIA plus people in general. LGBTQIA plus people have higher rates of cancer as well as HIV. Many of them have pre-existing conditions that make them immunocompromised because of HIV and cancer, and that will also make them more vulnerable to COVID. And we will hear from other people today that are more expert than I on this, but COVID will become a pre-existing condition here because of the uncertainty of the way it interacts with our immune system and our internal organs. COVID is also in and of itself extremely high risk for transgender people, specifically transgender women who are on hormones, because if they get COVID, they can no longer stay on hormones because of the risk to their liver. And so the Affordable Care Act interacts in this way during a global pandemic for all of us who need affordable health care, but also specifically for trans people because of pre-existing conditions. Many trans people's, their insurance denies them gender affirming and gender inclusive health care coverage, and so they have to pay out of pocket for things like hormones and surgeries, and spiking the rates of hormones and the cost of gender affirming healthcare is going to be dramatically affect the trans community. 1 in 5 trans adults right now, like even before COVID, has a chronic condition that would be considered a pre-existing condition. So removing the ability for insurance companies to deny on the basis of a pre-existing condition will further discriminate against transgender people. Of course, we know that President Trump and the executive branch removed the earlier provisions that were in the Affordable Care Act that are no longer there. The Affordable Care Act created provisions that protected transgender people from discrimination in healthcare services, so that they could not be denied healthcare on the basis of being trans. Those non-discrimination protections are gone. They've already been removed. But we can't afford any further losses. It's already hard enough because of discrimination for to get trans people into healthcare situations where they feel safe and that they are being covered adequately and they're not paying out of pocket. The transgender community is at high risk here for all sorts of reasons, not just physical care, but mental health care and the cost of mental health care and prescriptions that go along with it. And so I'm here today to advocate for the most marginalized and the most oppressed in our country, and specifically Black and brown trans women who are under attack, who have no protections in the workplace, and now have no protections against being denied health care unless they live in a city with a human rights ordinance, and would further lose their ability for affordable care if they're unemployed or their employer doesn't include insurance, especially insurance that's gender affirming, that will take care of them and their needs. So I urge you all today, and I'm urging our state senators, Marcus Rubio and Rick Scott, to please vote no on the Barrett nomination, and let's take care of our people. We voted you into office to take care of us. Florida's healthcare crisis is getting worse and worse each day. You need to stand with Florida as you stand with the United States altogether. And I've already posted the information on how to reach out to Rick Scott and Marcus Rubio, both by Twitter and by phone, and a link to an email that you can click into and send to Senators Rubio and Scott. But I will also post it on Facebook Live so that our viewers on Facebook Live can join us. Please post hashtag Save Our Healthcare and tag the senators. And in fact, at this point, your congressmen in Florida and congresspeople in Florida. And if you need help doing that, please just message the Florida National Organization for Women Facebook page, and someone will get back to you.
Thank you so much, Lakey, and thank you for all you do for so many people in this state and this country. This summer, Lakey and I have had the privilege of working with Dr. Howard Kessler. I think we've been to the governor's mansion about 5 or 6 times this summer, trying to get the governor to mandate masking in public statewide, and then to slow down on the opening up of schools until we know they're safe for our kids. And now he's in phase 3, where he's thrown open the bars, the restaurants, everything in Florida. And Dr. Kessler, the reason we've been working with him all summer on this issue is because he is the state president of Physicians for Social Responsibility, Florida. And we're so happy for the work he does through the PSR Florida and the work he does with us. And thank you so much for being here, Dr. Kessler. I know you're a busy man. So talk to us about healthcare and the dangers we're in, especially in a pandemic.
Thank you very much, Barbara. Very gracious words. I'm Howard Kessler. I am a retired physician, and as Barbara said, president this year of Physicians for Social Responsibility, Florida. So we know that when unemployment goes up, as we are seeing in the United States, the number of people uninsured goes up. And if the Patient Protection Affordable Care Act is further weakened or eliminated, the number of uninsured will also go up. Statistics over this last decade reveal that after the passage of the Patient Protection Affordable Care Act, more people were insured. During the last 2+ years, this trend has reversed, and we've seen back-to-back years of more uninsured people. That has not happened before in this decade. The Trump administration has taken steps to further weaken the Patient Protection Affordable Care Act, or Obamacare, or ACA as it is become to be known. President Trump has said many times that he wants to abolish the ACA. Instead of working to improve our nation's health insurance, the Republican Congress and our current president have worked to weaken and eliminate it. We are living in a difficult and dangerous time as we deal with the COVID-19 virus. If the ACA is eliminated, it would mean at least another 12 million Americans would become uninsured because of Medicaid expansion that was allowed under the ACA that would not be available any longer. More Americans would not be able to afford to buy insurance if the ACA were abolished because of elimination of protections from pre-existing conditions. The Congressional Budget Office 10-year forecast published in 2019 predicts that under President Trump's policies, the numbers of uninsured will continue to rise by millions. Gains in healthcare coverage under President Obama have been reversed under President Trump. Here in Florida, Governor DeSantis is willing to let thousands more Floridians become infected, become ill, and die of the coronavirus. Because of his misguided and non-science-based decisions, we will have many more Floridians seeking medical treatment. Without health care insurance, many may not seek treatment in time to be helped. Many will face financial ruin because of the expense of medical treatment. And yes, it's known to affect our elderly, people of color, people in need, and our oppressed minorities the hardest, but the young will not be spared. The young will carry the virus to the most endangered groups, and they will suffer. Now Governor DeSantis has opened the restaurants and bars full throttle. Students have been ordered back to schools. The governor's actions encourage young to mingle without social distancing. They will become infected. The numbers of cases are expected to surge. Governor DeSantis's use of herd immunity without a safe and successfully proven vaccine is ill-conceived, not science-based, and will result in more Floridians contracting the virus, becoming ill, and dying. Before I end, I want to mention what the utilization of herd immunity by our governor will potentially mean. Because Governor DeSantis is not trying to control and tamp down this virus, and he is allowing more people to become infected. Because of this, and in addition to this, the illness and the death that Governor DeSantis is forcing on Floridians, he is allowing the virus to enter more people. When that virus enters more people, when the virus has more hosts to exist in, the virus has a greater chance of mutating into a new virus that is resistant to COVID-19 antibodies or to the future vaccine that hopefully we will be able to develop. Governor DeSantis is setting Floridians up for a second wave of a new virus with more infections and more deaths. In the midst of this dangerous and lethal pandemic, this is not the time to decrease health insurance. This is not the time to discourage social distancing. This is not the time to make decisions not supported by our best doctors and scientists. Governor DeSantis, please stop endangering the lives of Floridians. You have at your fingertips some of the very best epidemiologists, scientists, and doctors in the world. Reverse your ill-conceived plan and start to help Floridians. And please, to all, remember to get your flu shots and vote. Thank you very much.
Thank you, Dr. Kessler. You know, people have mentioned pre-existing conditions in everybody's talk this morning. So we have a woman right here in Tallahassee who has joined us today who has a pre-existing condition. You know, this affects real live people. It's not just some term that we throw around. So welcome, Teresa Wells.
Good afternoon, everyone. As Barbara said, I'm Teresa Wells. This is very, very personal to me. In February of this year, I was one of the 207, almost 300,000 women who will be diagnosed with breast cancer in this country this year. In addition to that, in 2011, I was diagnosed with a precursor condition for multiple myeloma. I cannot even bear to think of what my life would be like if I could not pay for my health care. I was looking at my last explanation of benefits just through July without having just everything done that I could have had done. It would have cost me $80,000. I don't have $80,000 to pay my bills. Even beyond my personal situation where I have to be monitored for life, for the precursor, also for the breast cancer. I have counseled cancer patients primarily and people with other health conditions for about 30 years. My heart breaks to think about what these people will do, what their children will do, who are sick and who need quality medical care. Our elected representatives have to do better. To me, it's a moral issue. They need to look in their hearts and they need to do what's right for the people they serve. This is just unbelievably scary. You know, we've got to do better. These elected officials have just got to do better. I want to thank everybody who has talked about how horrible this will be for all of us. My precursor condition, for example, affects 3% of the population and people over the age of 50. And that's without widespread testing. So, you know, with it, for example, I run a greater risk of fractures, blood clots that are life-threatening. I have a 2% greater likelihood of contracting infections. It's, what will I do? I'm also more prone to have autoimmune conditions. I need my insurance. And these people I talk to and try to help every day, I certainly do. You know, Dr. Kessler could probably back me up on this. Our emotions have an impact on our health. People who are sick don't need to be stressed and worried that they can't get the care that they need, that they don't have the money to pay their medical bills. So I plead with Rubio and Scott to do the right thing for Florida. Please. Thank you, Barbara.
Thank you so much, Teresa.
Barbara, I just wanted to let you know that Reverend Pamela Andrews has joined us and is on.
Great. Thank you so much, Pastor Andrews. Another example of why we don't need to lose our health care under the Affordable Care Act. So, Reverend Pastor Andrews, go ahead.
I'm trying to get on. Good morning.
Good morning.
I am Pastor Andrews, and I pastor in
Pastor Andrews, you hit mute. We can't hear you.
All right.
There you
Good
go.
morning. Thank you. So I'm Pastor Pamela Andrews. I pastor in Panama City, Florida. I am very grateful to have the opportunity to speak in regards to Affordable Care Act, because I do push Affordable Care Act in my community, as we call the melon popping with brown shade individuals. I have been a healthy female all my life. No major health issues, in not anything, but when I turned 50, everything just seemed to go downhill for me. So I'm diagnosed with fibromyalgia. I can't afford Lyrica out of my pocket. I'm on Affordable Care Act now. I need my medicine. Not just that, I lost my first part of my thyroid. I think I was about 35 or 36. I lost the last half of my thyroid in 2016. So I don't have a thyroid, so I have to have Lothrotson every day. I can't afford it. When I didn't have Affordable Care Act and I lost my job, that one prescription was like almost $300. And I was just blessed to get on Affordable Care Act. It is very important. It's if people look at me now at 52, all of that is pre-existing conditions, and I'm not going to be covered. I would pray that Senator Rubio and Senator Scott would not look at the balance of parties and look at the people. We, the people, voted you in. We trusted you. Whether we voted for you or not, you're still our voice. We're still your constituents. We need Affordable Care Act. People, and if you don't want people in poverty to suffer, then show us that you don't want us to suffer, because it's not just the elderly, but also the whole community is impacted. African Americans, we are always impacted with underlying issues. My father died of small cell breast cancer. Small cell lung cancer, and he also had colon cancer. Then it went to his liver, and I am prone to, because it's hereditary with colon. So I am prone. I need everything that I can have to have my health care. I've been working since I was 13. I've been paying taxes since I was 13. My first job was Panama City Beach. So in all of that, to say this is that everybody matter, everybody is important. This COVID-19 is a wake-up call for everybody, senators. Everybody is being impacted, whether it's economically, whether it's mental, and the mental health component is very important, especially in African American communities now, that we are acknowledging that there is an issue. I have a daughter who has ADHD with other mental health issues, and she's on affordable care. I need everything that I can, and I'm paying taxes. So I would like for you all to save Affordable Care Act. It's a purpose, our Obamacare, whatever word you want to put on it, we need it. We need it now. especially after what we have viewed in 2020. We need Affordable Care Act. Thank you for the opportunity.
Thank you so much, Pastor Andrews. And thank all of our speakers today and all of our participants who have tuned in, zoomed in, and the media. Are there any questions from the media at this time? No questions? Lakey, do you see anybody trying to get on?
There are no questions from the media in the chat. There are a few important comments from people that are directly impacted. I'm not quite sure if you want me to read them out since we have no questions from the media.
Yeah, that'll be fine.
Okay.
A few.
So Sheila Jaffe is saying that many covered by the Affordable Care Act work for real small businesses, not ones with 500 or more employees who cannot afford to cover their employees. It looks like her son Scott, for instance, is a self-employed independent contractor, and so is her daughter Robin. Both of them will be impacted upon the loss of the Affordable Care Act. Sheila Jaffe again says uninsured Floridians arriving in emergency rooms with advanced untreated illnesses will overwhelm the hospital and physician network with debt as well as with patient overload. The American Cancer Society predicts poor survival rates when treatment is started in late stages, if ever. So these seemed like important comments that are in the chat. And I'll look at the Facebook Live, but I don't see any questions from the media in the chat.
Okay, thank you so much, and thank all of you. And just remember, participate. The Twitter storm, I guess, has already started since it's afternoon and goes on till 2. And then we'll resume the Twitter storm, #SaveOurHealthCare, tonight during the presidential debate from 9 to 10:30 for the Twitter storm. Thank you all so much. And if you would like to participate and help us in our ongoing campaign to lower prescription drugs now, please contact me at barbaradevane1@yahoo.com. barbaradevane1@yahoo.com. And I will plug you into this very important campaign that will be ongoing for months now till we get those prescription drugs lowered. So thank you all for Zooming with us today, and we'll see you next time.